Good morning and thank you for being with us. This is Khalil Hachem with US Arab Radio. We have a great show for you today. This is one of the special shows about health. And today we have a very interesting topic. Americans are making fewer babies than they used to. What is going on and why is the birth rate dropping in America and what can be done about it? With us this morning is Dr. Nicholas
The
Shamma.
U.S. Arab Radio Network is the largest Arab and Muslim.
Founding member of IVF Michigan Fertility Center and founder of Gift of Life Surrogacy Agency, is a world-renowned infertility specialist in Michigan and Ohio. He has performed thousands of IVF cases and has helped many more achieve their dream of parenthood. Dr. Sharma, good morning and thank you for being with us.
Well, good morning to you and to all our listeners. It's still darkish outside, but
Yes,
eventually we're going to change the time and it'll be a little bit more light in the morning.
absolutely. It's going to be a little bit colder, but it's okay. Winter is coming.
You know, the beauty about Michigan is that we have all four seasons and people don't appreciate that, but
That's true.
we keep it as a secret, the people that live here. So
Exactly. What I like about Michigan is there are no snakes and no scorpions. I love that.
okay, well, that's one of the advantages.
And good water quality.
Okay, no lizards either. I mean, if you're going to go there, but that's
Yeah. So
good.
what's going on with fertility rate? Why is it dropping? What is it now? Where are we now?
Okay, so I mean, just for my listeners this morning, so that they understand what we're going to be discussing, I think we're going to discuss a couple of issues. One of them is called the total fertility rate. The total
Okay.
fertility rate is basically how many kids, on the average, does a couple produce and what's happening to it over the past years. Just historically, if you go back, let's say to the 1960s, it was around 3.3. So two people will have around 3.3 kids. And that's a good thing because then the population grows, then the economy grows, and all of that good stuff. But since the 1970s, that number has been going down on and off consistently, but more so after 2007, it has consistently going down with no changes. And currently, as of last year, it was 1.6, meaning that two individuals have 1.6 on the average kids, and that's below the replacement level of 2.1. And you might say, well, why is it 2.1, not just two? Because two people have two people, and then the population remains the same. It's because of infant mortality. Infant mortality and mortality in general is somewhere around, I would say, 6 in 1,000. So that number takes into account that loss of infants after they are born. So we need at least 2.1. Currently in the US, it's 1.6. So that is that's what we call the total fertility rate. And we can talk about what are the factors affecting it. We can talk about, let's say, why is it changing? What policies we can put in place to offset that,
So
and so on.
why is it dropping?
Okay, I mean, before I do this, let me actually just put a little bit this issue in perspective. Currently in the United States, infertility is a concern because imagine we have 340 million people in the United States, maybe around 12, 14 million of undocumented immigrants. So maybe 360 million total. If you look at fertility in the United States in the past year or so, this is very important, 1 in 6 women will have infertility, and 1 in 11 men will have infertility in the US. And that makes, in a sense, around 1 in 6 couples in the US having issues with trying to become pregnant or staying pregnant and delivering healthy kids. So if you look at this, I mean, we have a problem here. And the problem is that we don't have enough kids at the end of the day. And if you think of it this way, you might say, well, we have technologies to offset that. I mean, and to put, again, this in perspective, in the US, every year, around 3.6 million babies are born. And 3.1 million of us die at the end of on the average each year, which gives us somewhere around 400,000 extra births than deaths. With that being said, think about it that only around 250,000 embryo transfers are done from in vitro fertilization, from the stuff that we actually do.
Yeah, yeah.
And that is only equivalent to around 2.6% of the births in the United States. So we have a lot to do if we want to move the needle just from technology services, from infertility technology services. So that's just a little bit of the background. Now, in the question that you said is why is the total fertility rate decreasing is because of, I would say, quite a few factors, economic factors, whatnot. But in general, before we even go there, maybe we should discuss what does it mean to have a decreased total fertility rate? Number one, it means an aging population, meaning that we will have more old people than young people. The other thing that it also means is that there is a slower population growth and therefore slower economic growth. The third thing is, I would say it would pose a lot of strain on Medicare, Medicaid, what have you, and Social Security at the end of the day. And in the short term, this is long term, in the short term, there's more like issues related to downsizing in terms of school systems and so on. But this will lead us, those two things, into what are the causes. I would say the main cause is economic. Economic, and in the past, we used to think it's all biological, but it's mostly economic because this is happening not just in the United States, where two individuals have 1.6 kids. Let's give you an example. Canada, our neighbor to the north. I actually don't know about Mexico, but I know Canada is 1.3, even lower than us. But Canada has a more robust immigration policy to offset that. And we don't in the United States have a very robust one. I mean, we have a sort of disorganized one, I should say. But to make a long story short, in Canada, it's 1.3 kids every two. For every two individuals. In China, it is one, meaning that at the end of the decade, even though for the next 20 years, the Chinese economy will bypass the US economy in terms of size, but we will overtake them again by the end of the current century. All because this total fertility rate in China being 1. In Japan, it's around 1.2 to 1.3. In France, it's similar to us, it's 1.6, but a lot of places in Europe, it's 1.3, similar to Canada. So unless you have policies in place or good immigration, robust policies to allow enough people to live in, so to provide, then we have a problem. So the main cause is economic. What does it mean? I'm talking about, let's say, costs related to child caring cost. And child caring costs could be direct and indirect cost. And in general, what those means, like child care, housing, healthcare, all of that, education, all of it is a concern, correct? So all of those factors are important factors in affecting the chances of people having kids. The other one is delayed marriage, delayed partnerships, delayed having kids, and marrying later leaves you less years at the end of the day for you to have a kid with your partner. So therefore, and just to put that in perspective, years ago, it was in the early 20s. Currently in the United States is 27.5 years for the first baby to happen. It's moving up. In Western Europe, it's 30 years of age. So that biology creates less reproductive years available for women to procreate. So yes, child caring costs are important. That's part of economic cost. But then there are delayed childbearing is also another reason. And I would say delayed even pregnancies, even within the marriage, because we'll talk about that in a little bit, I think, if we have time. Now, there are also other economic issues, housing constraints. For instance, there are not, in my opinion, there are not enough family-sized units in areas where they have good, where there are high opportunity areas to that degree. And therefore, because we're not having enough family size units and not enough or affordable housing or rent or mortgages or whatever it is, that puts more burden on childbearing. So, and another factor in my mind is what I call it career sequencing, meaning career comes first. And some people believed that you are penalized if you have kids earlier in your career. You're penalized. And therefore, to some degree, you should delay childbearing, and that childbearing process shifts to later. So, in essence, this career sequencing and maybe student debt affects it too, because all students now graduating from college or whatever it is have enormous debts that they have to utilize, and they have to pay the debts. And how can they pay for child caring? How can they pay for housing? How can they pay for any of that stuff? Now, this is all important, the economic structural parts and the biological parts, but then there are what I call work and time constraints. Imagine families, both parents work, there is not enough time. They're dual earners, correct? And therefore, there are schedule inflexibility because they have long commutes or and not enough time available for them to have kids and take care of the kids at the end of the day. So all of those are important factors.
Yeah.
Now, I can tell you that there's something, I discuss it oftentimes with my wife. We grew up a little bit differently than some of us who grew up elsewhere, not in the United States, as young kids. I call it intensive parenting. So now we have every night I have to do something with my kids, especially my youngest one, because the others are in college, or finished college. But my youngest one, has sports every single day. And I take him everywhere. So this intensive parenting doesn't create enough time for some people to have more kids. Sure. And then all of them are anxious to some degree about future opportunities. How about AI now taking over the globe and we won't have enough work? And I think AI might help, because if we don't have enough people, maybe have enough robots that do the
Sure.
I'm joking here, but the point is, so this heightened standards for readiness in my mind could nudge or push births downwards.
Yeah.
Most of them don't feel ready to have kids or bring kids to this life. Now, all of those are important factors in addition to policy issues. Now, let me tell you something.
Before we talk about policy, let's take a short break, Dr. Shamma.
Sure.
We're going to take a short break. We'll be right back. Please stay tuned.
Okay.
With more than 30,000 successful in vitro fertilizations, IVF Michigan is now ranked as one of America's best fertility clinics according to Newsweek magazine. IVF Michigan fertility centers are the recognized leaders in high-quality fertility care. With locations in Bloomfield Hills and 9 other cities in Michigan and Ohio, IVF has experts in all aspects of the field. A founding member, American board-certified Dr. Nicholas Shamma, is one of the leading reproductive endocrinologists in Michigan and Ohio. He has performed over 20,000 successful IVF cases, and it's helped thousands of couples fulfill their dreams of parenthood. When it's time to get personalized care from Dr. Nicholas Shamma at one of America's best fertility clinics, call IVF Michigan Fertility Centers in Michigan and Ohio at 248-487-8084. That's 248-487-8084.
Welcome back, and thank you for being with us. We're talking to Dr. Shamma about the fertility rate dropping in America. Dr. Shamma, we talked about economics, we talked about lifestyle, and and you were mentioning policy before we went on break. What is it about policy that's really affecting birth rate in America?
Yeah. Okay, I always like to if something comes to my mind. We at IVF Michigan now and IVF Ohio Fertility Centers, we're part of a much, much bigger network. I think, and it's what we call Pinnacle Fertility, and we're very proud that we're part of that network. And that network now allows us the flexibility of having more technology in terms of processes that are put in place to allow us to deliver better care to our patients. That's at the end of the day, and it allows integration of systems to allow us to deliver those services to our patients and get the best success rates, which we've had for years, but even more so. So we are very proud that we're part of Pinnacle Fertility. And the availability of services, we'll discuss them in a little bit, might result in some policy changes that could help with the fertility rate in general. So the question is, why is it that some countries have slightly higher fertility rate than others? Now, clearly, if they help immigration, because then you have more people, correct? I mean, who cares if you're making them and you can import them? True.
Yeah.
So you don't have to produce them, you can import them.
Okay. Bring them in, yeah.
Bring them in. Yeah. Now, you should bring them in my opinion, legally. Or structurally or according to some sort of design, not like haphazardly in a sense. Yeah. So that is one. The second thing is that countries that sustain better policies in terms of paid leave, universal affordable childcare, which we don't have in the United States, housing support, even cash or tax incentives like Western Europe, will allow the total fertility rate to not even continue to fall down. So all of those are general policy effects, and just to put this in some perspective, there has been many studies now recently that show that if you do 1 day of remote work for both partners, Khalil, 1 day per week of remote work, you can increase the number of kids per families by around 0.2, which is basically you can up the total fertility rate from 1.6 potentially to 1.8. So that is one of the very, very crucial aspects of things practically that can be done. Now, with that being said, I mean, what is the current administration in the United States doing? And they've been trying to do something. So that's the question that you asked. But I just wanted to put this in perspective a little bit so that you realize that there are certain countries that already do all those things, the paid leave, the housing, the taxes, whatever, that helps at the end of the day not keep that total fertility rate declining or even improve it if we can.
Absolutely. You gotta have the foundation and the systems in place for this to be remedied correctly, you know. And I do get it. I mean, you know, I come from a family of 7. All my siblings, the most we have is 3 children each. And who knows what their children are gonna have, you know, and I'm talking about third world country, you know, not even America. So, and again, it is the cost, it is the systems that are not there.
So you have 2 kids, Hisham, correct?
I have 2 kids, yes.
Okay, Khalil has 2 kids, and I'm changing the total. In my family, I had 6 kids, so I tried my best to keep the total fertility rate a little bit higher in the US. and the reason for this is because I married young. Yeah. So I had my first kid when I was 24. At the end of the day, if you don't have enough biological years, and you don't have the economics to raise 6 kids, then you won't have 6 kids.
Exactly.
So at the end of the day, these are pivotal factors. So what is the Trump administration doing? I think they're trying to do a lot. So actually 5 days ago on October 16th, which we're talking about like literally 5 days ago today, 1st of October, they came up with new policies. One of them has to do with the drugs that we use in infertility.
Okay.
Trump administration made a deal with both with Merck, and which is part of what we call EMD Serono is part of Merck, to allow us to purchase the medicines that we use in vitro fertilization. These are the Gonan F, the Ovidrel, the Cetrotide, at quote unquote the most favorable nation cost which is considerably less than others. And they basically, it's large discounts, but this is not going to go into effect until sometime in 2026. And it's called the Trump RX. I love it. Trump RX plan. So I think it would be great. But again, I mean, it will not affect everyone trying to have a baby. It's only people that come to me that need eventually. I mean, at the end of the day, and I just mentioned that it's only going to change 2.6% of the total births in the United States. So it's not going to move the needle very much. But clearly for those doing IVF or trying to do IVF, maybe if they get the medicines at substantially lesser cost, that helps them at the end of the day, especially if they're paying. The other thing is they came up actually on October 16th, what we call new federal guidance in a sense, but it again has not been implemented substantially to offer fertility services similar to vision and dental, that what we call stand-alone fertility services that employers could offer their, the people that work for them. As a broader insurance mandate. So they're encouraging those companies to offer fertility services similar to dental, similar to vision. And a lot of us, you might have to pay a little bit extra to be part of this, but at least it will offer those types of services, in addition to the federal government offering infertility services, IVF services to their federal employees or to the armed forces and so on. So all of those are very good things in improving access to, high-tech, subspecialized services like the ones that we offer. In Michigan, particularly, I mean, talking about new changes, and we've talked about that, Khalil, you and me before.
Sure.
When they, as of this year, as of April 1st, gestational surrogacy became available in the state of Michigan. So for us, that Surrogacy Act that was enacted makes even surrogacy available in Michigan. But you have to remember that, again, it doesn't move the needle in terms of the total fertility rate. It just offers some niche people or groups of people that need those services, the availability and the flexibility to actually partake in it and become parents and have families. So all of those little things help, but I still believe at the end of the day, the economic part trumps everything, not to use the Trump RX thing, but it supersedes everything.
Sure.
Now, there is a minor thing actually in that announcement on October 16 that came out that suggested that they're going to do expedited, this is very important, expedited FDA review of certain fertility drugs. Currently, the market is almost controlled by two companies in the United States in terms of fertility medications. By offering more options, have more competition, and therefore lower cost, always. So to this degree, I think all of those things, in addition to the expedited reviews of already existing drugs, and it's a wonderful drug because that drug basically is also a combination drugs like that contains both FSH and LH, but it's something that we use in infertility, will make the price is lower just because there's more competition. There's more than one product that we can offer our patients. And the take home, in my opinion, message is the IVF medication cost and benefit design, how am I going to put it, does not, in a sense, affect the market too much compared to what we call upstream drivers, meaning better childcare affordability, better paid leave, better paid house, better assisted housing or affordable housing. And so it might help couples on the margin requiring infertility services, but the move by itself will not move the total fertility rate unless the federal government enacts those things related to childcare, affordability, tax benefits, and so on. So all of those could help, but but not when you need to enact structural changes
Sure,
in
sure, sure,
in,
sure, sure.
in people's
It's
lives.
one component of many others that needs to come together to really make a change.
That is correct. And maybe in the next few minutes or so, whenever you decide, we can talk about other lifestyle changes
Yeah.
that could help the total fertility rate, because there are lifestyle changes.
Let's take a break and then we can come back and talk about other lifestyle changes. We're going to take a short break. Please stay tuned.
With more than 30,000 successful in vitro fertilizations, IVF Michigan is now ranked as one of America's best fertility clinics according to Newsweek magazine. IVF Michigan fertility centers are the recognized leaders in high-quality fertility care. With locations in Bloomfield Hills and 9 other cities in Michigan and Ohio, IVF has experts in all aspects of the field. A founding member, American board-certified Dr. Nicholas Shamma, is one of the leading reproductive endocrinologists in Michigan and Ohio. He has performed over 20,000 successful IVF cases, and it's helped thousands of couples fulfill their dreams of parenthood. When it's time to get personalized care from Dr. Nicholas Shamma at one of America's best fertility clinics, call IVF Michigan Fertility Centers in Michigan and Ohio at 248-487-8084. That's 248-487-8084.
Welcome back and thank you for being with us. This is Khalil Hachem. We're talking to Dr. Shamma about the low fertility rate in America. Dr. Shamma, before we went on break, we were talking about life changes and what other life changes that can happen to help fertility get better.
Well, the most important lifestyle change is have kids earlier.
Yeah.
I mean, that's not easily done because of the economic constraints that we just mentioned, correct, Khalil? I mean, so at the end of the day, there is a limited period of time for biology to have to allow kids to happen. And just to put this in perspective, if you look at miscarriage rates in women, for instance, in their 20s, it's around 10% of kids miscarry, or pregnancies miscarry. If you look at women in their early 30s, meaning 30 to 35, somewhere around 15% of them miscarry. If you look at women between 35 and 40, imagine 20 to 30% of them will miscarry. If you take women after 40, even if they get pregnant, half of them to 75% of them miscarry. And they might not get pregnant. And why is all of this? Is because of biology. Because eggs are in such a way that when you're 30, somewhere around half of the eggs are genetically normal. If you look at women in their 40s, almost only 10 to 20% in the early 40s are genetically normal, and almost none of them after mid-40s. So this biology dictates that maybe we should have kids earlier. So whatever economically we can do to make marriage, and that's the best lifestyle thing, happen earlier, the better it is. I'm not suggesting that we should have teenage pregnancies, because that's disastrous too. So encouraging early marriage, early pregnancies, meaning early pregnancies within reason, between somewhere between 25 and 30, would help in the total fertility rate. Now, for that to happen, you also have to tackle, in my opinion, an issue that has not yet been, but I think it will get better a little bit. So let me explain to you what I mean. There is an issue that has to do with women in the United States in their reproductive age becoming a little bit heavier. To the extent that if you think of 40% of reproductive age women are obese, and almost 60% of them are either obese or overweight. That affects ovulatory patterns, meaning women that are obese are less likely to ovulate. Now, if we can make them less obese, even the ones that want to conceive would be more likely to conceive, because I just mentioned to you that 1 in 6 women have problems conceiving, and that contributes dramatically to that, in addition to the delayed childbearing part of the story. So what are we doing about it? Well, I mean, now we have wonderful drugs for that. We have something called GLP-1 agonist, GIP agonist. These medications like Zepbounds, like the Manjaros, like Ozempics of the world, all of them dramatically diminish your weight. Meaning that you will have a better weight before pregnancy and therefore more likely to become pregnant. So I think they are so new, those medications, in the past 3 to 5 years, that it hasn't yet impacted on a population scale the weight issue in the US.
Okay.
But clearly that is something that can be done from a medical point of view, not just economic point of view, that could help in the total fertility rate.
What's the best age for a woman to have children?
In the early 20s. But, I mean, but most of us in the early 20s are still in college.
Yeah.
I mean, for me, I mean, I can tell you personally, I mean, I had my kid, my first one, Stephanie, I was 24, and I don't remember her growing up because I was at that time a resident and worked 120 hours a week. And she was, I mean, it was like insane. But yet I had her and it worked out somehow. She turned out to be okay. So to make a long story short, I think the best age is in the early 20s for women. For men, age also matters, by the way. There's even more data actually published even last week that there are certain genetic changes with men as they get older in terms of them having kids and whatnot. But that is substantially less of a concern than women in general. But I still believe that at the end of the day, certain things practically for families that they can do has to do with the following. For instance, since the economic reasons trump everything else, I would say if you're going to find a job after you finish your college, your graduate degrees, whatever, ask for or seek what we call predictable scheduling or hybrid options, because that allows you more time to take care of your little kids at home, whether it's men or women.
Absolutely. So, the fact that two parents have to work have something to do with it as well, doesn't it?
Yes, of course, because if both have to work, both have to leave house, I mean, who's going to take care of the kids? Somebody has to take care of them. Exactly. And unless you have affordable childcare, forget it. You're not going to be there. So that is one thing, is to seek some sort of a remote, some sort of a hybrid option. The second thing, in my opinion, is what we call have or seek employers that offer fertility services. So companies that offer, let's say, fertility care, not just diagnosis, but actually treatment. You'd more likely to have a kid if you join that company than if you need IVF and join a company that doesn't offer this, because it costs quite a bit to do in vitro, for instance, these days. Basically seek the companies that offer those benefits. The other thing is utilize what we call, what do you call them, FSAs, flexible spending accounts. So if you have those, use your FSAs to actually help in basically childcare, or not just childcare, in terms of even affording the fertility services that you might need, since 1 in 6 women have those issues. And then there is something, I call it regional cost arbitrage, which is what, in essence, move to a lower cost, affordable housing area, but still join an employer and work remotely if you can. So you don't have to live in New York City, for instance, to be able to work in New York City. You could live somewhere in New York, let's say, in generally, or upper Michigan or mid-Michigan, and have better affordable housing, but able to join a company that allows you remote access to work. So all of those are factors. Now, the lifestyle factors that affect fertility, we've talked about them, you and me, Khalil, before, maybe for men and women, which is
Yeah.
avoiding smoking, avoiding illicit drugs, better organic foods, better diets, better, I mean, all of those are factors that generally affect fertility. Avoiding sexually transmitted diseases and so on. So that will affect the some women and some men that have fertility issues, but doesn't affect the total fertility rate in general, correct?
Mm-hmm.
Clearly, any of those factors might help in the total fertility rate, but less so than economic factors. And I think the most important one that has happened since COVID, that we realized since COVID, and maybe we'll talk about vaccines, and that's what.
Yes. Yeah. Yeah. Well, we'll do that
Yeah,
after the break.
but exactly. But is that the ability for us to vote remotely? I didn't even currently, let's say at IVF Michigan, Pinnacle, Michigan, or and Ohio, we don't see patients as an initial consult in the office.
Mm-hmm.
All are done by telemedicine, and that helps our patients. Why? Because they don't have to come into the office. They don't waste time driving. They don't have to waste time from work. They can do it from their house. A lot of them do it while they're at work. They take like a break for, let's say, half an hour or so, go to their car and do it from their cars. And you could do it while your husband is somewhere and you are somewhere else. You can both access the telemedicine.
Absolutely.
So all of those things help. And on our end, but as far as patients are concerned, in terms of total fertility rate, like we talked before, if they have 1 day of remote work for both partners, you improve the total fertility rate by around 0.2, which is basically goes up from 1.6 to 1.8, which would be amazing if all of us do it.
Sure.
But not all of it is available. I mean, you can't remotely do something manual, for instance.
Yeah. That's the benefit of COVID. I don't think before COVID anybody could have convinced us to work remotely and accept it, but we had to deal with that during COVID, and you know what? It's great. I mean, I'm sitting at home doing the show, and you're at your office. And before we used to have to come to the studio to do this. So, and I mean, life has changed tremendously, and as you said, if we can take more and more advantage of that, it's going to help.
Yeah, totally. I mean, here's the thing. I mean, I have to do surgeries all morning after I finish this show. Okay, I can do that remotely. But in the afternoon, when I'm seeing patients for consults for new patients and whatnot, I do it from my home.
Absolutely.
I have 2 nice screens. I have my computers. I have access to all my computerized records. So technology does help at the end of the day.
Yeah.
Technology, the problem with remote work is some companies shy from doing remote work because then they have no control over their employees, correct? I mean, they don't know whether they're working, they're not working, they're watching TV or browsing the internet, and then they're not doing work. So, I mean, I can see the concerns why some employers don't like that. But I would say for the total fertility rate, it's wonderful.
Yeah.
Absolutely wonderful for people not to have to waste time and money commuting and just work from home if they
Infertility, infant mortality rate, has that changed in the US?
No, unfortunately it has not. It's still somewhere around, I would say, 5.6 to 6 per thousand. So it still has been the same over the past several years. And I wish it was lower, but it is not. And that contributes to why we need, for every 2 people, the replacement rate is 2.1. It's not just 2, because we lose kids in the process, unfortunately.
What we're going to do, Doctor, we're going to take a short break. We'll be right back, and then we can talk about vaccines. Please stay tuned.
Sure.
With more than 30,000 successful in vitro fertilizations, IVF Michigan is now ranked as one of America's best fertility clinics, according to Newsweek magazine. IVF Michigan fertility centers are the recognized leaders in high-quality fertility care. With locations in Bloomfield Hills and 9 other cities in Michigan and Ohio, IVF has experts in all aspects of the field. A founding member, American board-certified Dr. Nicholas Shamma, is one of the leading reproductive endocrinologists in Michigan and Ohio. He has performed over 20,000 successful IVF cases, and it's helped thousands of couples fulfill their dreams of parenthood. When it's time to get personalized care from Dr. Nicholas Shamma at one of America's best fertility clinics, call IVF Michigan Fertility Centers in Michigan and Ohio at 248-487-8084. That's 248-487-8084.
Welcome back, and thank you for being with us. We're talking to Dr. Shamma about fertility rate rather dropping in the U.S. And then before we went on break, we wanted to talk about vaccines. This has taken really a bad rap. The vaccine issue, and does it really affect fertility, or how do we separate facts from fiction?
Yeah, well, the facts are obvious. There is no question, Khalil, that vaccines do not affect the fertility rates currently in the United States. None. Zero.
Yeah.
They don't decrease fertility rates. They don't increase miscarriage rates. They don't do any of that stuff. On the contrary, actually, there is some data to suggest, let's say, just talking about COVID, because that's the most talked about vaccine as far as that. If you take the COVID vaccines, COVID itself, in men, for instance, has been shown to lower semen parameters. Because COVID does affect the testicles, because it's a multi-system disease and affects everything in the body. And in men, it has been shown to decrease the fertility rate, and the vaccines have not been shown. In women, it doesn't change anything in terms of miscarriage rates, chances of pregnancy, or anything related to whatever. So there was one study where it showed that the menstrual cycle was off after the vaccine by around 1 or 2 days, but that doesn't really change anything. But generally speaking, they don't affect the COVID vaccines, do not affect fertility rate, but COVID itself can and does affect fertility rates, especially COVID in pregnancy. But I explained about what pregnancy, Khalil, is a hypercoagulable state, meaning you are more likely to clot. And therefore, at the end of the day, because you're more likely to clot, if you add COVID to it, where you clot a lot more, and that's how COVID kills people, by clotting or pulmonary disease, most of the time, then you accentuate the risks during pregnancy. So we advise currently all our patients trying to conceive, especially because we have the flu season also now happening and the COVID season happening.
Yes.
That they get vaccinated for both. And when they take the influenza vaccine, we recommend that they take the inactivated influenza vaccine, the IIV, and because we don't want to give live viruses during pregnancy. And the second thing is that they should take the COVID vaccines. There are currently 3 COVID vaccines. One is by Moderna, one is by Pfizer, and one is by Novavax. 2 of them are RNA vaccines, and one of them is a protein vaccines, like all the other vaccines that we've taken. And in my opinion, because the side effects are a little bit less, and because it's a tested vaccine, meaning tested in terms of the biology of it, it's a protein-based vaccine. That would be a better vaccine to give rather than the RNA ones, because I don't know what the long-term effects of those are, because they've only been available since 2021 or 2020 in a sense. So to make a long story short, I would advocate to take the Nuvaxovid, which is the Novavax vaccine. And I would not always advocate doing them all together, but the data does suggest you can take them together to minimize, you going somewhere. And then a couple of weeks later, take the flu vaccine. The COVID first, then the flu for all women trying to conceive and their husbands so that they don't bring it home and then we're faced with it. So those are some vaccines that we advocate. And the state of Michigan actually maybe a month ago came up with, Governor Gretchen Whitmer came up with sort of not a mandate, but a strong advice from the Secretary of Health in the state to basically underscore the importance of taking those vaccines and made them available through any pharmacy that you go.
Yes. Yeah.
To be able to take them.
Yeah.
Now, in pregnancy, we also advocate two other types of vaccine that are critical, not just for mommy, but also for the baby after they're born. And this is what we call the diphtheria tetanus vaccine. And then the other one, this vaccine is given somewhere in the third trimester. And in general, what it does, it prevents the baby from developing pertussis, which is whooping cough after the baby is born.
Yeah.
And that is recommended for all women. And actually, it's pregnant women, but that's done in pregnancy because these are inactivated vaccines. Right? Now, there is other vaccines that contain live viruses. We actually, Khalil, ensure all women are strongly advised to be vaccinated for rubella and for varicella before pregnancy, but by at least a month. And why is that? Because these contain live viruses, and we don't want to expose women to live viruses while they're pregnant, even though the data doesn't show that they do much of anything, but we clearly do not advocate them being used during pregnancy. So all our women are tested for immunity prior to becoming pregnant. And if they're not immune, we strongly recommend vaccinations.
Okay.
Now, maybe that will lead us to discuss what we call the hesitancy rate.
Yes.
The hesitancy rate, especially in infants, or little kids, is affecting major disease outbreaks in the United States. So let me put this in perspective. If you look at vaccines in general, we're talking about the main one for kids, which is the MMR vaccine, the measles, mumps, rubella, the live vaccine that I just mentioned. We advocate all kids to take it. To prevent outbreaks, we need 95% of the kids in the population to have taken those vaccines. The problem is, if that rate falls below 95%, you're likely to have an outbreak.
Yes.
That actually happened in the state of Texas with measles. And it happened in other states. We have had an outbreak of measles because not enough kids are vaccinated for measles. And that is like insane in the 21st century for that to happen. So, and I'm totally in favor of parental autonomy. And I'm in favor of people deciding their own things and not the government imposing mandates and regulations on us in general. But at the end of the day, from a medical point of view, there are certain things that ought to be done and certain things that should not be done. Because the only way to prevent disease and promote health as far as communicable diseases is vaccination. There is no other way.
Yeah. We had Dr. Natasha Bagdasarian. She's the state's chief medical on this show a couple of weeks ago, and she basically, we talked about that, and she's very concerned about the hesitancy you're talking about, and the bad information out there. And she said that a lot of children are not caught up on in Michigan. They're not caught up on vaccines, and she's very concerned about that.
At least in Michigan, the state, meaning the state of Michigan, Dr. Bagdasarian I mean, I commend her highly actually for her efforts, are advocating the schools to make sure that their kids are vaccinated. And to have exemptions, non-medical exemptions for vaccinations, I think is opening the door for disasters to happen in terms of epidemics.
Absolutely,
So
absolutely.
I can understand if somebody is allergic to the vaccine or somebody has some medical condition that precludes that kid from taking a particular vaccine, correctly. But in terms of the parents decided for one reason or another that they do not want their kids to be vaccinated, puts not just the kids at risk, but puts the whole community at risk, because then you're not preventing disease and you're not promoting health in general. And if you ask those people in terms of, vaccine hesitancy, if we approach it to them that all of us have one motto in mind. I mean, we don't work for the pharmaceutical companies that make the vaccines. We're advocating those vaccines as physicians only to promote health, only to promote the kids' health.
Mm-hmm, mm-hmm, mm-hmm.
So that is something paramount in the way we should basically frame the question or the discussion, that we are all for the same effect, which is basically promoting the health of kids and preventing the transmission of communicable diseases. The only way to do it is with vaccinations.
Yeah. Political opportunists who take issues out of context and then find audience and they try to spread all of these lies about vaccines and others, and is really not helping. And I'm really surprised in America that they would find a tremendous audience.
You know what? I think it all emanated from the very, very poor way of how those vaccines, especially in relationship to COVID, were basically rolled out, in a sense. It is amazing that we were able to develop those vaccines in the speed that we were able to develop them, because we prevented a lot of deaths. And the data clearly shows that now those vaccines, let's say for COVID, prevent hospitalizations, prevent sick. And that's why I took them and my family took them and so on.
Yeah, we did too.
Yes, but the point is, that rollout was not done with adequate public health announcement, and there was
very hasty. Yeah.
No, it was hasty. It was not organized. You heard something from this part of the political spectrum, and you heard something from another part of the political spectrum. And this is not politics. This is actually medicine, and epidemiology, actually.
Yeah.
So people, I mean, that really set the tone for that vaccine hesitancy that had major, in my opinion, sequelae, and will continue unless it is addressed from the top down, from the policymakers in Washington down to the states, down to the people.
Absolutely. We got 4 minutes left, Dr. Shamma. Is there anything we haven't talked about that you want to shed light on?
Not really, but I mean, to go back to the total fertility rate, I mean, I think no single thing can be done immediately to offset that. I mean, in China, they know that their total fertility rate is 1, and they're sort of almost doomed in terms of their economies because of the policies that they did 50 years ago for the one-kid policy. Now, we are not 1, we are 1.6, so that, thank God, we are good. But what can we do? I'm talking about things that has to be put in place. Affordable childcare at scale. At scale. And that includes vouchers, caps, supply growth. All of those are things that can be done in affordable childcare to allow people to go to work while their kids are taken care of, because you can't leave them at home by themselves. I mean, we are humans. We are dependent in the first 10 years of life, at least maybe 12. Paid parental leave is important.
Yes.
Paid parental leave for men and women, not just women, for men too. I mean, I had 1 day of parental leave when I had my first 2 kids. 1 day.
Mhm.
So paid parental leave is important because that allows us to have better bonding with our kids. That has nothing to do with total fertility rate, but allows us also better income and sustainable income while we consider having other kids. So this is critically important, this paid parental leave for women and also men. The other thing is what I call predictable, flexible work schedules, meaning hybrid options should be on the table. And the evidence that we talked about suggests that it is small, but a real effect at the end of the day. Now, another economic thing that they can potentially do is what I would advocate for family-sized housing near jobs and schools. For instance, you have to have the structural ability in this county you live in for better zoning, for better reforms that allow
Services, yes, services and all of that.
units.
Yeah, yeah,
Yeah,
yeah.
and then I would strongly advise the federal government to do the following: targeted cash and tax incentives, like they do in some places in
Mhm,
Europe,
mhm, mhm.
tied to child costs, meaning it's not clawed back because your income is a little bit up, correct? Because the
Yeah.
people with the higher income might have even more kids if they are allowed the tax and the child cost, credits in a sense. So all of those are factors, in my opinion, to help not just having one kid, but more than one kid. And maybe the better fertility services like
Mhm,
they're doing in Washington and
mhm.
more of it would help maybe move that needle further and improve the total fertility.
Yeah, yeah. Well, Dr. Shamma, it's been a pleasure talking to you for an hour. We really enjoyed and valuable information as always. Thank you so much for taking the time to be with us.
You're more than welcome. Thank you for having me.
Absolutely, absolutely.
All
Thank you
right.
for listening, and we appreciate your listening. Thank you.
Bye. Bye.